Good. Democratic Senator Mark Begich. We'll be talking to a GOP senator in the next hour. Senator, thanks for being with us. I want to ask you about a couple of your votes. You voted against amendments that would have blocked two things: $460 billion in cuts to Medicare and $43 billion in cuts to health agencies that provide nursing care and therapy to homebound Medicare patients. Don't your no votes hurt some of the nation's most vulnerable citizens, seniors?
Well, I think the way you've put it is, draws the answer. No one's here to hurt seniors. My mother's 71 years old on Medicare. If you saw the amendment we passed with Senator Bennett from Colorado, 100-0, was to ensure that those dollars for Medicare will stay in Medicare, that they would not lose services. I think what you're seeing, and I'm a new senator, so I see from a different perspective than some of these old hats that have been here, it's a lot of gamesmanship going on. Yeah. I mean, that amendment you saw, you're going to see it in some commercial, but the reality is one amendment that 100% of the U.S. Senate supported ensured that no benefits will be reduced for seniors, period. And I think that's what we have to keep in mind.
The reason why that was 100-0 was aptly put on the editorial page of the liberal-leaning New York Post today when they called that Bennett amendment meaningless.
In fact,
Senator, they called it meaningless, and that's probably because Senator Bennett himself, in a leaked memo, called it just a message amendment. It really was nothing more than that. But let me get to the heart of this here.
Well, but let me just say I disagree with you, and I think the core of this legislation, if you look at what we stand for, about saving lives, saving money, protecting Medicare, I'm telling you, as someone who has a mother on Medicare, has several aunts on Medicare, I understand the value of this. So when I hear the jawboning out there by both sides, there's a lot of misinformation out there. The bottom line is there is not one senator sitting in this U.S. Senate, Democrat or Republican or independent, wanting to reduce one benefit to seniors that have senior programs today. There is no question about it. So there's a lot of politicking going on here, but that's the core issue.
And by the way, if I said Post, I meant the New York Times. But Senator, if you're cutting subsidies to private Medicare plans, and you're cutting payments to hospitals and hospices and home health agencies and other providers, isn't it logical that they will, in turn, find ways to cut or eliminate some benefits and services to seniors?
Well, let's take the Advantage program, which very few Alaskans have this, but let me talk about it because I know a lot of Americans have it. And the bottom line is that program came along. It was supposed to be a lower cost program managed by the private sector at 95 cents on the dollar for what we pay in Medicare. End result, it is costing more money, 114%. So if they took that money and they put it into the current program of Medicare, they could offer those services plus more. That's reality. The comment you had just earlier from Senator Nelson in regards to the prescription drug issue is another example of where I believe, and he's right on that amendment, that we need to make sure that Medicare and Medicaid, just like Medicaid, we can compete and get the lowest cost prescription drugs. That's $106 billion on the table that have been left aside. So, there's a lot. This is a very complex bill. There's a lot of issues. You're going to hear a lot of political.
Well, let me ask you about another issue. Senator Ensign just introduced, I saw it, it just failed a moment ago, he introduced an amendment to curtail exorbitant attorney's fees in medical malpractice lawsuits, which drive up health care costs. Indeed, there was a recent study by the AMA which found that we could save $200 billion per year by adopting tort reform. Now, did you vote minutes ago in favor of the Ensign amendment? And if not, why?
Absolutely. No, I did not. And I'll give you an Alaskan example. We did tort reform in 1996-97. It reduced the amount of caps to $400,000 per individual, $8,000 per life expectancy of economic life up to 50 years. So $400,000 maximum. Here's what happened. Premiums doubled in the last 10 years. Here's what's happened to premium costs for medical liability. They did not go down. The cost per visit of doctors went up, and the amount of doctors available. In theory, tort reform is supposed to allow more doctors to enter the market. That did not happen in Alaska. So we have a real example of where this did not work. But put that aside for a second. That amendment was one-sided. It dealt with only the plaintiffs, not the insurance company lawyers. They could spend whatever they wanted, as much as they wanted, to basically deny people who maybe lost a limb improperly in a medical procedure or ended up paralyzed. that bill, that amendment was one-sided. So when you talk about tort reform, let's be honest about it and talk about the whole picture. But the insurance companies had no repercussions on what they would spend.
Cases, what's factored in is the plaintiff's contingency fee, and that drives up the cost of premium coverage. But let me move on.
I gave you an example in Alaska. That is not true in Alaska. Our premiums doubled with tort reform. The cost per doctor visit went up, and the amount of doctors per capita in our state went down. So somehow it didn't work. What the president has suggested on tort reform in his speech several months ago was a demonstration project to look at examples of what works, what doesn't work. And he's going to do it without Congress. And I think that's a good move on his part.
Is there a version of a government-run public option that can get the necessary 60 votes in the Senate? And if so, what version among the several would that be?
Yeah, I think that's going to be a tough nut to crack. I think there is a group of us in the moderate wing of the Democratic Party working aggressively to try to figure out how to ensure that the government isn't holding the bag at the end of the day, that there is more options, more choice, more competition within the insurance delivery system. One of the things I've talked about not only in my campaign but during this process, and it seems to be getting some headway, is I believe we should just replicate what the federal system is, in the sense of what myself and 8 million other employees of the federal employees as well as their dependents receive today. Just replicate that. It's competitive insurance. It limits the profit on those insurance companies, but its private sector gives a better choice. I just recently looked at my paycheck because people believe that some senators have some Cadillac version, and I actually brought it because I just got it a few days ago, and
right.
I looked at it. I pay $5,500, my share,
right,
for my premium costs. And so I think there's a little headway on that kind of concept going on right now.
Let me ask you one other question. If a bill gets out of the Senate and it goes to a House-Senate Conference Committee, do you think Democrats will try to pass a merged bill, whatever it looks like, under reconciliation rules with only 50 votes instead of 60?
I'm not supporting that, and I don't think people will support that because this is a pretty comprehensive piece of legislation, 1/6 of the economy. We need to do it right. We shouldn't use any of those procedures to change the way the process works here. Even though I will tell you as a new member, it's a painful process, but it is what it is, and we should live with it.
All right, Senator Mark Begich, thank you so much for stepping outside your last vote for a few minutes to speak with
Absolutely.
us. We much appreciate it, sir, and thank you.
Thank you. Have a great day.